Doctors of Reddit, what is something that you wish everyone knew about their body? This one is more about medication. Antibiotics only work against bacteria, they are not some kind of wonder potion that cures anything, and they should not always be given. Please stick to your prescription the doctor gives you. Even if you already feel better, don't just stop unless the doctor says you can stop. A lot of medication needs to be taken according to the prescription in order for it to be effective, because you build up the doses to an effective level. Stopping or not sticking to it really decreases effectivity. Tell us what drugs and alcohol you're on. We aren't gonna tell the cops. We aren't gonna lecture you, but it might change the anesthesia I give you. Some stuff I give you might kill you. If you drink a 30 pack a day, tell me. Ejaculating blood happens to most people at least once in their lives, and in 99% of cases it resolves without taking any action within a week. It doesn't even warrant a doctor visit. Peeing blood, for both sexes, is a serious medical emergency and you should immediately go to the ER. People think it's the other way around. How to eat healthy. Just because you're skinny doesn't mean you're healthy, especially the teenagers who I take care of. Sometimes I will ask them what's a healthy food your doctor wants you to eat. Rarely do I get a right answer. I feel like the internet has so many fad diets, and family members rarely cook, so families don't know basic nutrition facts. If you could keep track of the assorted parts you've had removed or added, that'd be very helpful. I'm not saying you need to know whether your fundoplication was a Nissan or a door, but if you're complaining about belly pain, it would be nice to know that the last time you had belly pain they took out your gallbladder, appendix, sigmoid colon. And if you've ever had something implanted, and they gave you a little card, that's not warranty information. That tells us if you're going to explode if you go in an MRI. Bring it, otherwise it will be googled. That there is a wide range of normal. Don't be embarrassed by your body. Having said that, if you are concerned about anything, ask your doctor. We have generally heard it all before, and trust me, we have, nearly always, seen it all before. Maybe you have something that has been bothering you for ages, but you were too scared or embarrassed to ask about it. Just ask. It might be nothing and you have been stressing about it for no reason, and if not, then you are at least one step closer to getting it fixed. No one can help if they don't know. There are no stupid questions, so ask away. I'm always amazed when I have been asked about something that has been bothering a patient for years and years, but they were too embarrassed, scared to bring it up. Most of the time, it is nothing, a completely normal body function feature. Other times, it is something that should have been discussed right away. You know your body best, so speak up. Don't wait for the doctor to ask the right question. Some people seem to think that if you act healthy for a bit, it'll make up for being a wreck. There are so many things wrong with this. Just one example, antioxidants are like gas for your car. You can store up a certain amount of vitamins, but your tank can only hold so much. If you binge and overfill your tank, it doesn't do anything. You excrete it out as waste, and you can't expect to go the next several months without gas just because you tried to overload it before. You're going to still need to get gas. Same goes for your fruits and veggies. Had someone tell me he went vegetarian for a few weeks, which meant he was done for the year, he was dead serious. Had a patient at risk for heart failure try to insist that if she stayed away from salt entirely for X days weeks, she should be able to have her fill of McDonald's fries and ramen. Had a smoker argue that if he stopped for some time, he should be able to smoke freely for a while. With some digging, stopping turned out to mean a couple less cigarettes a day. My phone is acting up, so if this has already been posted I apologize. But women, please do not use soap or douching products inside your vagina. It has a delicate pH balance and this is how you get yeast infections. Wash your labia, but do not clean internally. The vagina is self-cleaning just like your eyeballs. Do you wash your eyeballs? Number. Do you wash your face? Yes. Don't do DIY surgery or hold off on reporting things that are obvious warning signs. Don't be the guy who tried to remove his skin cancer with a knife. Doctors hate him. They really do. You need some kind of exercise. Doesn't matter how you feel right now. Sitting for 12-16 hours a day will have negative consequences. Your kidneys and liver cheerfully do all the toxin elimination you'll ever need. Cleanses and other detoxifying products are bull's woo and a waste of money. The people who sell them are predators who only care about your money becoming theirs. Type 2 diabetes is more serious than most people realize. I work as a doctor in hemodialysis and most of them are due to diabetic nephropathy. It also affects your eyes, nerves, immune system, etc. Simple life changes can help you, but no one seems to care. I even lost 9 kilograms myself because I had a family history of diabetes and to be healthy. How to check for skin cancer. If you see any moles or anything that are A. Asymmetrical. B. Odd borders, like they're jagged or something. C. Color different colors. D. Diameter. Grows. E. Evolve. Well, evolves. Go get it checked out. It might be skin cancer. There is no cure for cancer as it is traditionally thought about. Cancer is a class of many very different diseases, each with very specific causes, i.e. some molecule that went wrong allowing a cell to multiply out of control. Even within the same type of cancer, i.e. lung cancer, there are many types of lung cancer, such as small cell, large cell, squamous cell, etc. Even within the same subtype of cancer, there can be different molecular mechanisms that caused it, requiring different approaches to treatment. Looking for the cure for cancer is like looking for the cure for disease. That administering CPR compressions ASAP is one of the greatest indicators of successful outcomes. Had a guy roll in post-Torsad's arrest. The guy behind him at the DMV when he went down was an ICU nurse who started compressions within seconds and got the ED attached. Patient came in talking with his only complaint being chest pain from the compressions. I wouldn't have believed it if the medics hadn't given me the rhythm strip. Where the orifice each gender urinates through really is. Antibiotics are not some magic cure for every pain in your body, nor for the flu or common cold. Never ever boil breast milk. In my country there is a popular belief that breast milk jaundice in newborns can be treated by boiling one's breast milk. But by doing this you destroy all the nutrients and it basically becomes as nutritious as water is. Do not give honey to children below the age of 1. Do not rub your child with rubbing alcohol as to lower his fever. Baby wipes don't substitute daily bath showers. Yes, I am a pediatrician. Antibiotics are not some magic cure for every pain in your body, nor for the flu or common cold. This is a common belief among my peers, which is weird, because I'm a biology major and you'd think biology majors would know this. This is going to sound really basic, but I wish my patients would know what meds they are on when they come to the hospital. At least once a day comes somebody in who goes, yeah, I take 8 pills in the morning, 3 in the evening, and 4 at lunch, but don't ask me which. You're a doctor, you should know. I beg of you, before going to a doctor that has never seen you before, write your meds, doses and all on a piece of paper. I'm a vet, but I'm sure some doctors will have come across this too. Amputated limbs do not grow back. I've had far too many people asking how long it will take for their pet's amputated limb to grow back, so I'm assuming a few doctors out there will have had patients asking the same of their own missing limbs. Maybe those people you've met think all animals are like lizards. JK. I think sometimes it's shock or fear of what might be ahead and how things might change that makes people say that. And then again, some are just stupid or ignorant. Also, thanks for what you do as a vet, taking care of vulnerable creatures. You often will feel normal even with high blood pressure. It's often found incidentally, so don't wait until it gives you symptoms you don't want to go through. Your mental health is just as important as your physical health. You only get one body. The way you treat it has a significantly higher impact in how your health will end up in a decade than what sort of interventions we can give you. You really should treat your body like a temple. That the immune system is an incredibly complex and nuanced organization of cells that communicates readily to destroy anything deemed hostile within the body. It helps explain why vaccines are supposed to work, why allergies come and go, and why transplants are hard to successfully pull off. My immune system is so complex, it attacks my own body. Good times, good times. I'm a dentist, and if you don't take care of your gums, your teeth will fall out of your head and you'll get PME when your jawbone atrophies and your denture doesn't fit anymore. Baby doctor here. About to graduate, unless you have liver or kidney failure, your body detoxes itself really well. But don't get scammed by these detox teas and whatever. Can we put this on the front page of everything? My mom tells her teen patients' parents alert that the acne isn't the teen's fault but runs in the genes sometimes when it's bad. Injuries accumulate. I cannot stress this enough. Little kids have no business lifting heavy weights or getting pushed so hard in sports by some of these coaches who seem to have little knowledge of physiology or don't care about the long-term impact of the regimens. Stuff like this really changes people's lives. That they only have one in their behavior now, drinking, smoking, not taking medicines, or whatever will impact their life quality and expectancy. Sounds logical, but very few patients really realize it. High blood pressure doesn't have symptoms majority of the time. It's called the silent killer and causes a plethora of other illnesses. Holy crap, this needs to be a SR. Kids, stop getting those magnet piercings on your mouth. Every week a dozen idiots come in swallowing them. Once in a blue moon we have to take them to theater, open them up and fish them out. The issue is if they don't come out by you crapping them, there's a risk they make a hole in your bowel, fistula, and it becomes an emergency. That's why we'd rather fish them out before we have to cut out bits of your bowel. I'm not a doctor, but as someone that works with those who may be in a psychotic break, get sleep. Most psychosis happens because someone haven't had slept or haven't had good sleep for extended periods of time. Some people just need 20 straight hours of sleep and then they never end up in a psychiatric hospital ever again. And don't just randomly stop your medication because you feel better. You feel better because you have consistent amount of whatever is leveled in your body now. And now that your body is hitting equilibrium, everything is going great. So keep doing what you're doing. I've seen people go on and off their medications for years and it really starts to mess up your body if you do that for too long. It's okay to seek treatment for your mental health. Don't feel ashamed because you were diagnosed with an illness. Seeking help is a strength, not a weakness. That psychological states may infuse bodily symptoms, and that saying so isn't dismissing that the symptoms exist. I think it just needs to be worded carefully because very easily it can be misconstrued as it's all in your head. But people don't really understand the mind-body connection. In males, there is a vestigial remnant of the uterus located in the prostate. It's called the prostatic utricle. It is a duct that leads nowhere. It sometimes has some remote endometrium in it and can produce 1 drop of blood every 28 days. Source: embryology professor in med school. So yeah, guys can get PMS too. But it's probably better to call it BMS, or premenstrual syndrome. I call it menstruation. Take care of your kidney. If your renal function is shot, it closes the door on so many options. Actually a doctor. I wish people would know that when I say, I don't think CPR is in your relative's best interests, I am not saying I am going to withdraw all treatment immediately. CPR is brutal, and it has a much lower success rate, even if done promptly in hospital, than the movies make out. If you are old, or have a lot of medical problems, then the success rate goes down even more. If I don't want to do CPR on you, it's not because I want you to die, it's because I don't want to fracture your ribs, expose your body to a huge group of people you don't know. Everyone loves attending a crash call, and repeatedly assault your dead body for nothing. I want you to die with dignity and care if there is no chance of bringing you back. In summary, CPR is great and everyone should learn how to do it. It does save lives. But if a doctor suggests it should not be performed, please give serious thought to that. We don't suggest a DNA CPR for no reason. This times 1,000. 90% of arrests I've been to have been on patients that shouldn't have been resuscitated. It's horrific. Teeth are the most disrespected body part. A healthy set is as important as a healthy heart. Infective endocarditis is a thing too. Not a doctor, but never flush unused medicine down the toilet or throw it in the trash, especially not antibiotics. Hand them back into your pharmacy and they will destruct them. Neonatal provider checking in here. Feed your dang baby. The badge of honor you get for exclusively breastfeeding isn't real. Dehydration, severe hyperbilirubinemia, hypoglycemia, these are all real and happen all the time. Feed your baby. Lots of hospitals will even let you use donor breast milk initially if you are strongly opposed to formula. Just feed your baby and don't use a cup or a spoon. The lactation consultants will tell you that babies know how to lap it up. Well, you didn't give birth to a kitten. If your baby has an intact suck reflex, you should use it. It allows the gag reflex to work better. If you feel strongly about the concept of nipple confusion, it's not a thing, then ask for a SNS system. Tape that tiny tube to a boob and let your kid eat that way. Just feed your baby. Also, this nonsense about how a baby only needs a few drops of milk in the beginning because their stomach is only the size of a walnut. True, their stomach is small, but much like most other stomachs, it stretches and empties pretty readily into the small intestine. Plenty of babies eat a full ounce right out the gate. Vag. Lastly, if you have a home birth and your kid ends up coming to the hospital by EMS, please let us do our job. If you don't want any of the care we offer, then please refuse EMS. Or don't even call them to begin with. Drink water. Not a doctor, but I'm a trauma nurse. Motorcycles are freaking awesome, but they are also death machines. Don't ever get on a freaking motorcycle. But if you do anyway, wear a freaking helmet. Not just a helmet, but all the proper gear: leather jacket, motorcycle pants and shoes. A t-shirt and flip-flops will not protect you if you go down. Absolutely avalanched here, but your brain is an organ like any other, susceptible to disease and malfunction. When crap is going awry mentally, it is in absolutely no way different to lungs struggling with bronchitis. Your skin, biggest organ, brain dudes, being overtaken by some weird rash, kidneys or gallbladder pumping out stones. You get the point, I hope. If you've got a brain, then you've got mental health to look after too. Bottom line, just because the output is mainly social doesn't mean the disease disrupting your life isn't as important. Our brains are awesome, but also sometimes misguided in how to preserve our well-being. Tell someone. If they don't listen, tell the next person. But the best person to talk to is always a mental health professional. If you don't cinch with them, just move on to the next one. No biggie. Your whole body will thank you for it in the long run, my friends. You've been visited by the Good Policy Grandpa. You will be blessed with good economics and healthcare, but only if you comment Sleep Well Burner. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check out another video, or don't. Either way, have a great day, you magnificent people.